When someone has a heart attack, time is critical. Hoag Memorial Hospital Presbyterian in Newport Beach has initiated a Code 60 program, which mobilizes paramedics, ER staff, and doctors to get the patient into the catheterization lab to open up the cardiac artery within 60 minutes. Dr. Richard Blankenbaker explains the program and the procedure.
The Code 60 program was a unique program developed here at Hoag Hospital. The purpose of that program was to develop a way for us to get our patients having a heart attack to a life-saving procedure as fast as possible. Our goal is to get the patient a life-saving procedure in under 60 minutes. The Code 60 program here at Hoag starts with the paramedics. When a patient calls 911 who thinks they're having a heart attack, when the paramedics arrive at their house, they perform an EKG. That EKG can diagnose a heart attack very quickly, and once the heart attack is diagnosed, the paramedics then call the base at Hoag Hospital emergency room. Once the patient is transported, they are initially brought to the emergency room where further testing is performed. And if a heart attack is confirmed, then the Hoag cardiac cath lab team and cardiologists are called in, and the patient is taken directly for a life-saving procedure. The importance of calling 911 very soon after you suspect you're having a heart attack relates to the amount of damage done to the heart muscle when you're having a heart attack. A heart attack signifies that the heart is not getting a sufficient amount of blood, and given long enough, that heart tissue dies and unfortunately does not regenerate. However, if you're able to get the patient having a heart attack, if you're able to restore the blood supply within an hour or less, you can significantly reduce the amount of damage. And that's why it's so important that if a patient thinks they're having a heart attack, they contact 911 immediately. That sets the system in motion so that that patient can get treated as soon as possible. The symptoms of a heart attack can vary greatly from person to person. Generally, it involves some type of pressure, discomfort, or pain in the center of the chest. Frequently, that pain will radiate to the left arm, both arms, up into the neck or into the jaw area. Occasionally, people experience pain in unusual areas, such as the back or in the upper stomach area. People having a heart attack will also frequently have other symptoms, such as severe sweating, shortness of breath, nausea, or dizziness. But the important thing to remember, if you have risk factors for a heart attack, such as high cholesterol, high blood pressure, diabetes, if you're a smoker or there's a strong family history of heart disease, then any significant discomfort in the chest area should be taken seriously. Heart disease affects men and women equally. Men tend to have heart disease at a younger age and present with the more typical symptoms of crushing chest pain. Heart disease is still the #1 killer of women as well, but it tends to occur a little bit later in life, and their symptoms, women's symptoms may not be as obvious as men's. They may be much more subtle. The symptoms may not involve chest pain as typically you see in men. There may be other symptoms such as dizziness, unexplained sweating, severe shortness of breath. So although the incidence of heart disease is significant in both men and women, in women it's sometimes harder to detect.